We have a right to health equity. Māori have a right to health equity, both under Te Tiriti o Waitangi and the United Nations Declaration on the Rights of Indigenous Peoples. The United Nations Declaration also says, as well as health outcomes, we have a right to develop our own solutions and implement them through our own institutions. So I'm chair of He Pikanga, which is the National Māori Cancer Leadership Group. We've worked in partnership with the new Cancer Agency to develop the National Cancer Action Plan, and Mātauranga has a place within that Cancer Action Plan, so that's very important for us to help develop that component. We're also looking at governance, so that's very important from a treaty perspective, is to actually have shared decision making and shared power and control over what gets funded in the cancer space and how it gets implemented and developed. As part of the National Science Challenge, I co-led a project called He Pikanga Waiora, where we developed a Māori implementation framework for how to implement solutions in a way that works for Māori. And we co-designed with Te Koho Health and Kotiri Trust 2 projects to help prevent progression from pre-diabetes to diabetes. Those 2 projects have been very successful, so the participants have had reduction in weight, reduction in their HbA1c. Some of them have gone off all of their diabetes medication. One of the things we wanted to look at was the value of te reo in diabetes prevention. So we partnered with the University of Waikato, and we looked at people who had pre-diabetes and then those who went on to get diabetes, and saw what the factors were that influenced that progression, and found that people who could speak te reo Māori were less likely to go on to get diabetes. That's a really interesting finding. So one of the great things that I'm proud of is developing and facilitating a racism and cancer workshop that we ran at the Ministry of Health. There were other workshops going on at the time, and our racism and cancer workshop was the most oversubscribed. So we need to value te reo in healthcare because we have a right to that, and people are ready and willing to have that conversation.